What is fatty liver? It is a condition of fat accumulation in the liver, seen in overweight individuals or people with diabetes or insulin resistance due to excessive alcohol use. Fat accumulating in the liver causes the liver to enlarge over time. In cases that were previously called simple adiposity and did not have a liver test disorder, inflammation develops over time and fatty liver disease steatohepatitis develops. These cases are at risk for developing cirrhosis and cancer. What are the symptoms of fatty liver? Fatty liver progresses without symptoms in most cases. In addition, it is associated with the fact that fatty liver is usually seen in people who are overweight or who consume too much alcohol. Tiredness, weakness, sweating, decreased effort capacity, shortness of breath, skin flushing, itching. It can cause symptoms such as a feeling of fullness in the upper right part of the abdomen. What are the causes of fatty liver? Alcohol intake, overweight, diabetes and insulin resistance, elevated blood fats, polycystic ovary syndrome, underactive thyroid gland, sleep apnea, pituitary gland failure, hypogonadism, medicines, nutritional deficiency, hunger, genetic and metabolic diseases, fast weight loss after weight loss operations, heavy metal exposure, the effect of overweight and diet on fatty liver. Overweight, a diet rich in processed foods and sugar. The lack of physical activity has caused obesity, which is shown as the epidemic of the age. The liver manifestation of overweight is fatty liver disease. At the same time, the fact that the person has no complaints does not mean that he does not have fatty liver. Being overweight and staying overweight over the years, it is recognized that it can cause many serious diseases, including cirrhosis and liver cancer. Does fatty liver cause other complications? Failure to treat fatty liver in a timely manner, hepatitis, cirrhosis, may cause an increased risk of liver cancer. With the discovery of effective treatments for viral hepatitis, it is predicted that the most common cause of cirrhosis, liver cancer, and liver transplantation will be fatty liver disease in the next 10 years. Moreover, heart attack, paralysis, cardiovascular diseases such as atherosclerosis are more common. How is fatty liver disease diagnosed? Whether there is damage to the liver, the degree of lubrication. It is ensured that other possible underlying causes are excluded. The amount of lubrication is learned by ultrasonographic examination. Evaluation is made in terms of progression to cirrhosis with an examination called elastography and using a specialized ultrasound. If cancer is suspected, other cross-sectional imaging methods such as tomography or magnetic resonance imaging can be used in cases where the diagnosis of fatty liver disease is in between. It may be necessary to take a piece of the liver biopsy under sedation and local anesthesia. The main treatment of fatty liver: losing excess weight, quitting alcohol. It is the strict control of diabetes in many patients in the treatment of fatty liver. Change your lifestyle. Eating healthy. Regularly exercising at least 150 minutes a week. 2 cups of coffee a day may be sufficient. Drug treatments in fatty liver are mostly used in the treatment of conditions such as underlying diabetes and high cholesterol. In the treatment of fatty liver, medicines to aid weight loss, endoscopic weight loss treatments, obesity surgeries are other methods that have been used in recent years. In fatty liver, preferring fruits and vegetables, reducing animal fats, reducing red meat and preferring white meat. It is recommended to prefer liquid oils rich in omega-3 fatty acids such as olive oil. Also in fatty liver, pastry, bread, rice, Avoid foods with a high glycemic index, such as sweets. Don't forget to like the channel and subscribe.